Here at Chelsea Hospital, we're with Judy Oak and Jane Zawistowski. They're members of the Chelsea Hospital Patient Experience Advisory Council. Great to see you both.
Thank you.
Thank you.
So, being Patient Experience Advisory Council members, you've been a patient at one point?
Mm-hmm. I have. Yes.
And you as well?
Yes.
And how many people are in this council?
So right now there are 6 members like us, and in fact yesterday we did our annual review and went over our charter. So we're looking to expand. It can be 6 to 10 members. So we never mind getting a few more.
Yeah, I saw something where they're looking for more people. They want more.
Yeah.
They want more. I guess diversity.
Diversity.
Yeah.
Yeah.
So why do they have this?
So there's a few reasons. We talked about that yesterday, but over the past few years, there has been some push to include the patient view on their health care, no surprise. And I think all of us have probably experienced that to some degree. So that's one reason, but it is a mandate, if you will, that comes down all the way from CMS, Center for Medicare Medicaid Services, as well as the Trinity Hospital System. So not just Trinity, but other hospital organizations do that as well.
Jane, this must be refreshing for you, coming from New York City, where they don't care what the patients think.
It has been. It's wonderful to be in a hospital that does care, and everyone from the people who sweep the floor to the nurses to the technicians, they're all very compassionate and friendly and professional, of course. But yeah, it's different.
Can you give me an idea of maybe what a patient experience is that you are able to communicate with Chelsea Hospital?
Well, I would probably answer that by saying, what does our agenda look like from month to month over the years? And it can be anything from the hospital is developing a new brochure for a new program, or a department wants input on some particular issue or concern within that department, and then they might want to bring it to us for feedback on, well, how does this feel like from a patient point of view? I think the one that stands out a lot in my mind, though, was during COVID, because it was very different what we did, and it was extremely rewarding. The group came to us and said, as with a lot of other healthcare facilities around the country, healthcare staff are burned out, they're tired, they're working hard, discouraged and so forth. Got any ideas? And so we did, and we took it to our community, who just, as always, rise to the occasion. And we did things like feed the front line, local vendors, stores, restaurants contributed their services to bringing in a meal during the hospital shift for a period of, I think it was 6 weeks. The local schools and daycare, senior centers, Silver Maples, CRC, our senior living arrangements, they wrote letters of appreciation. They donated gas cards. They did all kinds of things. And we posted those pictures, the artwork, on the hallway, which if you've been through the hospital, there are walls that hang the art from the community. So that one sticks out in my mind, because it was extremely moving and emotional. We dusted snow off the staff cars when it snowed at night. We put notes on their windshields saying thank you, things like that. I still get choked up about it because it's very moving.
It was. One of the things we did more recently was we reviewed all this new signage for the hospital to make sure that it addressed concerns from the community, and everything from which signs and what directions are needed, and how do they look, and where will they be located. So that was interesting. That was the voice of the community making sure we can get in, because one of the complaints we have is that sometimes the signage was not helpful.
And it's not just patients, but you also have family members. So what they may experience as their family member is a patient.
Right.
I thought when I saw that Chelsea had this, I thought, well, this is just going to be a big complaint department. I had to wait too long or things like that, but it doesn't sound like it.
I told you earlier, I volunteer, and I volunteer in the gift shop. And one of the things, people who have family here or who've gone through the diagnostics, imaging areas, they'll come in and they are overwhelmingly positive about not only the care they get here, but how well they're treated, how kind people are. One lady in particular came in, she had some disability issues and she'd been going to imaging in Ann Arbor, and she came here and she was so pleased because the technicians were patient with her, they gave her assistance when she needed it, nobody hurried her along, and that's the kind of feedback we get. And one of the things we do is we pass it along, make sure that the group knows about it and that that information gets back to the departments.
Yeah, the hospital does have that reputation as being warm and friendly. Do you feel a responsibility to maintain that as a member of this council?
I think I feel a responsibility to listen to what I hear in the community. I worked here at one point for many years, have been a patient here, but I'm now a community member, and I expect I'll probably end up here one day, but perhaps my family as well. So, we live in the community and we hear things, and that is really our role, is to be a liaison and bring good or bad. And we occasionally do get somebody complaining, and over the years I've brought that, hey, I heard this, and so forth, and it is listened to, which is really great.
So it's not just what you think, it's what you're hearing in the community.
Exactly.
We're also, another role we play is that we can be advocates for the hospital. And when we hear about changes in policy, we're really able to go out and explain, because we discuss things at our meetings. We've had Ben Miles come to our meetings. We've had other members of the administration come and talk to us and explained policies so that we can go out and we can talk to the community.
Have you seen things change or improve based on your feedback?
Yes. Yes.
Like the signs?
I'm sorry?
Like the
The
signs?
signs, but that didn't necessarily come from us. That probably came from the community. Our marketing director here, Jacqueline Klein, she brought that to our attention. Somehow people, they're going to complain, I can't find this, and maybe it came from the departments they were trying to seek, I don't know. But I remember once, this is a small thing, but it was a big thing for that department. There was concerns about the waiting room in diagnostic imaging. And so we just, we took a tour and went down there and looked and said, well, how about this and how about that? We've done that for a room that was being changed on one of the units that was in the older part of the hospital. And we made a field trip, I called it, to go down and say, well, this looks really dated, and maybe change this and add some color here. And they did change it, so they do listen to us.
One of the things we recently did was the department spotlights.
Yeah.
We worked with the group to, when you come in, you'll notice there's a poster board, and every month there is a spotlight on a department. So it introduces the department and the staff members to the community, and it also is a way to celebrate the different departments. And when it's your month, your department gets a visit from execs, right? Mm-hmm. And they deliver goodies. So it's a way to, again, make the community aware of the different areas, and also to celebrate the areas and make sure they're appreciated.
So you're both volunteers, and you have to be a volunteer to be part of the council.
Yes.
You're essentially volunteering.
During your time.
Yeah. So what kind of response Have you heard from the efforts that you've done, like during COVID with the meals and the department spotlight? What do you hear back from the staff? What's their response to having this council?
I would say very positive. I think they appreciate knowing we're there. And I don't know exactly how the average housekeeping person or a staff nurse or whoever, if they take it to their department head. We don't necessarily hear that. I can tell you that on one snowy night in, I think it was January 2022, when we were out at dark brushing off snow off cars at shift change, we did have some of the staff leaving, and they were blown away that, you know, I wish we could have gotten all of them, but we don't always know which cars are staff. We have a general idea, so I'm sure some visitors had their cars. They probably wondered about that. So yeah, we generally hear back from Lori, our nurse manager, that's the management team representative, on the positivity. Just heard that yesterday about the artwork. So.
The artwork. I know that when the spotlights, I volunteer in one of the departments that was in the spotlight, and they were really happy to be focused on and to have a little say. They got a picture, and they got some quotes from people in the department, and they really appreciated the goodies.
And even if it was visitors, you brushed the cars, imagine the stories they're telling around. Right. It's like, I went up to the hospital and I came out and they brushed all the snow off.
I think it's pretty cool that whether it's the hospital staff or the community, when you say you're a member of PIAC, which is what we call ourselves, they sometimes know what that means. You know, we've tried to get that visibility out there. Not everybody does, of course, but when you say Patient Experience Advisory Council, which is a mouthful, then, you know, you're just, again, being an ambassador for the hospital.
So you've helped the hospital learn a lot about patients and their experience. What have you learned about the hospital since you've been on the council?
I have no medical background, and which I find interesting that I'm on this group, but it's amazing what I've learned. I have a completely new appreciation for not only how professional the nursing staff and the technical staff are, but the amount of information, the skills that they have, and they're able to apply those skills in such a way to be just wonderfully personal and friendly and helpful. You forget when they're being friendly and helpful that they have got this skill set that is amazing, and they treat everyone so well. And I have just been amazed. I have a whole new appreciation for the nursing community.
I think one of the things I've learned, and it really isn't new news, but it is reinforced, is the hospital, I'll say leadership team, the administrative and management team, genuinely care about what the community thinks. This is an unusual hospital, as you referenced, and I think, you know, we're very bonded with the community. It's important. I mean, we talked about that yesterday. It's a long story, but I, again, it's reinforced in my mind, this matters here. You know, what we do matters. This isn't just a check the box committee, you know, and I think part of that is us too, that we have developed it in such a way that we don't want it to be that. We see that our voice is important, and but we don't run the hospital by any means, so it's just, you know, this is our input, you know, take it or leave it, but hopefully take it.
Nice.
So, yeah.
Well, there's room for more if you'd like to be part of this PIAC with Judy and Jane. The folks at Chelsea Hospital are looking for more members. Thanks for your time today.
Thank you. Thanks for asking.
Judy Oak and Jane Sałastowski, part of the Patient Experience Advisory Council here at Chelsea Hospital.